Hi everyone, a blessed day to all of you. Praying that all of you are doing well together with your families and loved ones. I am also praying for God's guidance, blessings, and protection be upon us all. So welcome to this course, the N101 Health Assessment. Congratulations for passing all the prerequisite subjects in this course. Your theoretical foundation in nursing, anatomy and physiology, and chemistry 131. So again, congratulations. I know you are familiar about the term health assessment. So health assessment is vital in your course because health assessment is the very first step in developing your nursing care plan for you to be able to deliver the best nursing care to your patient. So, health assessment are the key part of the nurse's roles and responsibility. So, this assessment can be your tool to learn about your patient's concern, symptoms, and overall health of your client. So it is a very critical step because this is where you can get the comprehensive data about your patient, including the physiological, psychological, socioeconomic, social determinants of health, spiritual, and lifestyle, which will help you to determine your nursing diagnosis. So the topics for this week includes the following: Introduction to Health Assessment, Critical Thinking and Health Assessment, and Interviewing and Communication. So you can find all these topics in your book, the Bate Nursing Guide to Physical Examination and History Taking, 2nd edition. So chapter 1 to 3. Health is defined as the relative state in which a person is able to live to his or her potential. That includes the 7 facets. Those are the physical health, emotional health, the social well-being, cultural influences, spiritual influences, environmental influences, and the developmental level. So it is not just solely the absence of disease or eating well. So hindi ibig sabihin na nakita natin yung isang tao, napaka-macho niya, or she or he is eating right or nutritious food, masasabi natin that the person is healthy. So health is a sum of those 7 facets that I've mentioned. These are the 7 facets that I've mentioned in the previous slides. And your health or a person's health are influenced by these dimensions. The ability of a person to adapt without compromising the 7 facets can lead to health maintenance. We know that health is not constant. Therefore, it should not be taken for granted. Okay, the ability of a person to align the 7 facets into a harmonious network can lead to a healthy state of an individual. So, physical health. Pag sinabi natin physical health, it refers to how your body works and adapt with the stressors. And emotional health, it refers to a person's positive outlook. Diba? So, kung positive tayo, maganda rin yung effect nito sa atin. Pero kung puro tayo negative ang iniisip natin, negative din yung magiging ang mangyayari, di ba? The social well-being, this refers to your how supportive is your friends and your family. Sometimes na sila pa yung cause ng inyong disease or illness, di ba? Because may problem with the family or problem with your friends, okay? The cultural influences. Okay. Ano ba yung culture? Ang culture ninyo. Okay. Is it favorable to promote the health of the individual? Ano ba yung usual na kinakain ng inyong, like sa atin mga Filipino culture natin, di ba? Mahilig tayo sa adobo, which is mataas ang cholesterol. Kaya, no doubt, marami sa atin ang hypertensive, diba? So, cultural din yun. Spiritual influences. Are you living peacefully, morally, and ethically? Ano ba yung belief mo? How it influence your well-being? The developmental health. Okay. So, developmental health refers on how one thinks, solve problem, and makes a decision. Sometimes, na-influence tayo with yung development natin, di ba? So, kapag bata ka pa, so iba rin yung decision making mo. As tumatanda tayo, nagbabago tayo. Natututo kasi tayo through our experiences. So, alam naman natin na kapag medyo bata, batang isip din, di ba? That's why sinasabi natin, batang isip kasi bata pa. So, as you mature, kung ano yung developmental level mo, childhood, adulthood, di ba? Nagkakaroon din ng pagbabago yung or changes of how you think, how you solve problem, and how you make decision. Okay. Ano pa? So that's all, no? The 7 facets. I think na-explain ko na yung lahat na yan. Right? So let us now proceed to the definition of health assessment. So it is defined as the processes used to evaluate the health status of a person. So processes, meaning you will undergo a series of steps. So may mga steps tayong gagawin for us to know the patient, for us to evaluate the health status of our patient. So parang naliligaw lang yan. So halimbawa, ikaw yung lalaki, you have to know the person first. Diba? Una, tatanungin mo muna yung pangalan niya. Ilang taon na siya, saan siya nakatira, and so on and so forth. Diba? If ikaw naman yung babaeng nililigawan, of course, you have to know the person as well. Sometimes nga, tinitingnan mo pa yung background niya, di ba? Yung kanyang family history, yung kanyang social history, ano-ano pa yung aalamin mo. For you to know kung dapat mo ba siyang sagutin or not, di ba? It's similar to that. Okay, but according to Bates, health assessment is similar to a puzzle. Okay. The first time you meet your client or your patient is like opening a puzzle of bats, diba? And then dumping out the pieces of the puzzle. So each piece of the history and examination data, it represents the life of your client. Okay, so isa-isahin mong i-connect ang mga yun for you to have the whole picture para makilala mo who your patient is. Okay, so yung review of system, according to Bates, it serves as the corner or the edges of the puzzle. So kapag meron ka ng frame, mas madali mo nang i-connect yung mga pieces of the puzzle. Bakit kailangan mong i-connect yun? And again, that is for you to know who is your patient. What would be the health problem, the possible health risk of your client. So, mas madali kang mag-develop ng iyong nursing care plan. Okay, you can do this by asking pertinent questions to gather data. You can start from general questions and then to a more specific questions. So, your health assessment includes the following: the comprehensive health history and the complete physical examination. Okay, so your health history includes the following data. The demographic data, example, okay, the name of your client, the age of your client, the birthday of your client, and so on and so forth. The chief complaint, why the patient visit to your clinic, for example, because of pain. Yan yung chief complaint. History of present illness. For example, nakikita mo, 3 days prior to admission, the patient experienced pain on the lower abdomen, etc. Okay? The past medical history. Nagkaroon ba siya ng surgical procedure in the past? Meron ba siyang psychological issues in the past? The family history. Meron bang, for example, Sa family, meron bang may hypertensive? Meron bang may diabetes? Yan. Personal and social history. Okay, saan nag-work ang patient? Is it a student or nag-work na siya? Okay, and marami pa, no? Cultural history. Pwede natin kung ano siya, Filipino ba siya or US citizen ba siya, and etc. Okay? Spiritual beliefs. Ano yung kanyang religion? Is it Roman Catholic, Iglesia ni Cristo, Muslim, or Islam? Yan. Review of systems. Of course, alam niyo na yung system, di ba? This is the human body. Okay, you can start from general, no, to physical examination. So, review of the system from the example, yung head, okay, skeletal system, gastrointestinal system, reproductive system, and so on and so forth. So, isa-isahin natin yan. Okay? So, physical examination is a structured head-to-toe examination. So, you have to start from head to toe. It identifies changes in the body systems. Meron bang, it's important for you to know what are the normal. So, sa health assessment, dapat alam mo muna yung normal. Tapos, what are the deviation from the normal? What are the unusual or abnormal findings that may support the history data or trigger new questions? Kasi, bakit halimbawa, itong area na to, for example, sa breast examination, the normal, di ba, dapat symmetrical yung size. Bakit hindi ito symmetrical? Okay, from that, pwede ka nang magtanong na iba, may pain po bang nararamdaman? May mask ka po bang nakakapa? You can have more questions from that. That's why it's very important for you to know what is normal and what is abnormal. Okay, and you have to document all findings in clear and concise manner. Okay, dapat klaro yan and specific. Collate all information with medical records. Okay, so let us now proceed to the nursing process. So, nursing process is a modified scientific method that we nurses will use in developing our nursing care plan for us to deliver the best nursing care. Okay, so nursing process is a problem-solving process that is to identify the patient problem, and then from there, you can prioritize your findings and be able to set your goal and develop an action plan. Or you can formulate a plan of care, and then you have to implement that plan, and then later on, you have to evaluate the outcome, kung naging effective ba ang iyong plan of care, or you need to revise your plan. Okay, so the nursing process has 5 steps. These are the assessment, diagnosis, planning, implementation, and evaluation. Okay, during assessment phase, the nurse gathers data via health history taking and physical examination. So, meron tayong subjective data and your objective data. I'm sure ituturo din yan sa inyong fundamentals of nursing. Okay? So, when we say subjective data, ito yung sinasabi ni client. Okay? Ito yung nafe-feel ni client. Siya yung nagsasabi sa iyo na, for example, masakit po yung tiyan ko. Yan. As verbalized by the client. Okay? When we say objective data, this can be observed by the nurse, okay, by your 5 senses, okay. And then diagnosis, okay, once you have your assessment data, okay, may mga datas ka na about the client, no, meron ka na ng subjective data and your objective data, you can now formulate your nursing diagnosis. You have to remember that your nursing diagnosis is different from the medical diagnosis. For example, yung medical diagnosis is appendicitis. Of course, hindi po yun nursing diagnosis. When we say nursing diagnosis, you can formulate your nursing diagnosis, you can use your NANDA book, no? Pwede kayong tumingin doon ng mga nursing diagnosis that is related to the data or the data you have from your assessment. For example, sinabi ni client na masakit or may pain si patient. Okay, so saan ang kanyang pain? Ituro niya that it is located in the lower right. Okay, probably or meron ka ng ultrasound that the cause of the pain is appendicitis. So your nursing diagnosis could be acute pain, example, no, related to inflamed appendix. Okay, so yun yung example ng ating nursing diagnosis. This is the problem, no? Ito yung nakita mong pinaka-priority problem na dapat mong i-address. And then from there, you can create now your plan. And your plan should be smart. Ano ba yung smart? Dapat it should be specific, it should be measurable, attainable, should be realistic, and timely or time-bound. And then, once you have your plan, it's now the time for you to implement your plan or your intervention. For example, sabi natin kanina, may pain si client, no? Upon assessment, the client complained of pain. And then, so your diagnosis is acute pain related to inflamed appendix. And then, your plan is to decrease the pain. So, how will you decrease the pain? Dapat alam mo yung sa assessment pa lang, yung subjective niya, dapat naging objective yon. Halimbawa, sinabi niya may pain siya. So, you can ask your client to rate the pain. Diba, i-rate niya yung pain from 0 as no pain at 10 as the worst pain. So, pag sinabi ni client kanina, I have pain na sobrang sakit, nasa 8, sabi ni client. Okay, your plan is to decrease the pain. So, at least to 4. After your intervention. Okay, so ano bang part of your nursing intervention? Baka sabihin mo naman kaagad, okay, of course ma'am, I will give a pain reliever. So of course, kapag pain reliever ang binigay mo dyan, that is already a medical action. Okay, so nursing action po tayo. How will you decrease the pain? Maybe you can teach your client to do breathing exercises, deep breathing exercises, or you can ask the client to listen into music or music therapy, or ano pa ba yung pwede mong gawin to lessen the pain of the client. Yung giving of medication is hindi na yun yung pinakauna mong part of your intervention. Yes, you can give pain medication as ordered by the doctor. Okay, so dapat ordered by the doctor yan. And then in your evaluation, that is the time for you to evaluate if your plan of care is effective or not. For example, yung pain na sinasabi natin kanina, after an hour, let's say for example, after an hour, kasi yung plan mo dapat meron kang long-term plan and short-term plan. So, dapat may short-term plan ka that after an hour, the patient pain will be decreased from 8 to 4. So, titignan mo ngayon during your evaluation if the pain of the client really decreased after your intervention. So, titignan mo, i-measure mo ulit. Sasabihin mo ulit kay Sir, Mrs. Chase, Mr. Chase, can you rate your pain now? Kasi sinabi ni Mr. Chase that my pain now is 6. So, hindi man na-achieve yung target which is 4, at least nabawasan yung kanyang pain. So, meaning, kahit pa paano, naging effective ang iyong plan of care. If not, and then you can revise your plan again. Okay, isip ka pa ng iba pang intervention to lessen the pain of your client. Okay, so that is the steps of your nursing process. And then, I think this will be discussed in detail in the next chapter or in your fundamentals of nursing. So let us proceed to the purpose of your health assessment. Why it is necessary to do health assessment? Again, that is to determine a patient's health status. To determine the patient risk factors, bakit kaya nagkaganito si patient? Smoker ba si patient? Or alcoholic si patient? Or sedentary ang kanyang lifestyle, kaya nagkaroon siya ng hypertensive. Determine the need for health education. So for example, smoker si client, maybe kailangan natin i-educate ang ating client what are the side effects of smoking in their health, not only in their health but as well as to their significant others that are living with the client, diba? So, and then to develop a nursing plan of care. So, in health assessment, every person needs to have a complete assessment. So, dapat kompleto yan. So, again, paano ba maging complete? So, kilalanin muna natin yung person. Diba? We'll start from getting all the demographic data, yung mga history taking kanina na na-mention ko. Ideally, it is done on admission. So, circumstances may delay the completion. Should be completed once the situation allows. For example, nasa ER, critically ill yung patient mo coming into ER. So, hindi mo naman pwedeng gisingin yung patient na yan or in pain yung client na yan. Baka mairita yan kapag very comprehensive ang iyong tinatanong. So, you have to ask direct questions na lang yung very important. Kung conscious yung client, yung mga importante mo na yung kukunin mo informations. And then, later na kapag medyo okay na si client or if the situation permits, pwede mo nang i-complete yung iyong health assessment. A patient with a professional relationship with the nurse just need updates, and a patient with dementia may require supplementation from the family. Kasi alam naman natin kapag may dementia, hindi na rin accurate yung information that you will get from the client. So, maybe you will need the help of the family member, immediate family member as possible. So, let us compare the nursing versus medical assessment. Okay, so the nursing assessment focuses on nursing diagnosis and the treatment of the actual or potential human responses. So it identifies many contributing factors to the individual health and the well-being. So our assessment is holistic, diba? We learned it from our nursing theories that when you care your client, it should be holistic, diba? Again, hindi lang naman yung physical, diba? Hindi lang yung physical aspect yung dapat nating iti-treat, diba? You have to treat the whole patient, you have to care the whole patient as a whole person or holistically. That involves the spiritual aspect, emotional aspect, physical aspects, psychological, and so on and so forth. The medical assessment focus is on the diagnosis and treatment of the disease. Very nakafocus na sila. Sometimes they don't consider other aspect of that person, of their patient. Okay, that's why nurses are here. Okay, so these are the healthcare team that are involved in the patient care. Okay, the nurse, the physician, the nutritionist, because of course nutrition kailangan din yun, di ba? Yung diet of the client, the specific diet of the client, the social worker, the physical therapist, the occupational therapist, the speech therapist, the dentist. Depende kung ano yung problem ng iyong patient. Hindi naman ibig sabihin lahat yan kailangan nandyan. Okay, kung ano yung specific problem of the client. Pero kahit ano man yung problem ng client yan, as you can see, hindi pwedeng mawala yung nurse dyan. Diba? Nandun lagi yung nurse and the physician. And of course, to follow na yung iba kung kinakailangan talaga sila, but still they are part of the healthcare team. So, in your health assessment, the nurse detects the areas of concern requiring immediate attention. So, paano ba yung pinaka-importante talaga? Is it the breathing? Diba? Airway, breathing, circulation. So, you have to prioritize. Ano ba talaga yung dapat life-threatening ba ito? Ano ba yung mas kailangan ni patient? Diba? Nurses uses findings to decide the areas that take a precedence. Ano ba yung mas importante? Halimbawa, may pain si client, naggangawa si client sa sobrang in pain si client, tapos may nakita ka, may mga ano rin si client dyan, may mga rashes din si client na na-observe mo, ano ba yung una mong i-address? Or may fever si client, napakataas ng fever ni client, ano ba yung unang i-address mo in your nursing plan? Health promotion and disease prevention are essential areas of patient education. So additional components include the individual's personality and attitude, resilience, family dynamics, access to healthcare and resources. May access ba sila o baka naman sobrang layo, nakatira lang ito sa bundok si patient. Nutrition, kaya bang bumili ni patient ang nutritious foods, the exercise ba si patient, ano ba yung culture and practices ni patient as well as the beliefs of your client. All of these additional components contribute to the health of your client. Okay, so let us now proceed to the role of the nurse in the patient's health. So the health goes beyond an individual patient, and it also encompasses the environment or the community of your client. So the role of the nurse here is the nurse is involved in shaping the public policy and social economic as well as the workplace decision. So ano ibig sabihin nito? So in order for the nurse to help or assess the patient, the community or the environment of the client must be nurtured. For example, para maging healthy yung isang individual o yung mga bata, for example, sa isang school, so dapat kasama si nurse, involved si nurse in creating policy of the school. Like for example, sa cafeteria, nagtitinda sila ng mga soft drinks, junk food sa canteen. Okay, elementary school ito. So, as a nurse, pwede kang mag-help in creating the policy na dapat sa canteen, nutritious food lang ang pwedeng bilhin ng mga bata. Kasi kapag wala silang makita dong soft drinks, wala silang makita dong junk foods, of course, mapipilitan sila to buy the nutritious foods. So that's an example of the role of the nurse, number 1. Okay? So, role of the nurse number 2. Okay, you have to use the findings and decide in which areas the patient needs the most care. So, from your data, ano ba yung mas kailangan ni patient ngayon? Pain ba? Or is it the temperature? Okay, deliver care across the lifespan of the client. Promote health and prevent disease. How will you help to promote health? And ma-prevent yung disease. Maybe you can give health teaching to the client. You can create or formulate health teaching. Okay, if you're a public health nurse, maybe pwede tayong gumawa ng mga programs that promotes healthy lifestyle like exercises, yung mga Zumba classes, yoga classes, or pwede kayong mag-health teaching about eating nutritious foods para maiwasan ang diabetes and hypertension. So that is to promote health and to prevent illness. For example then, community nurse ka, you can also create a program, yung dengue prevention. So paano ma-prevent yung dengue? Okay, or how will you encourage in our current situation? So what will you do to encourage the people to get their vaccine, diba? So educate and counsel individuals, families, groups, and communities. Determine what affects the patient's health. Ano ba yung nakakapag-apekto? Ano ba yung mga factors? Okay, tingnan mo yung surrounding of the client, the society, the family, the lifestyle of the client, and then focus on the health and goals of your patient. Okay, so role of the nurse number 3. The nurse must oversee the holistic care of each patient. So again, it should be holistic, not just the physical aspect. Collect the data that are necessary in creating your nursing care plan. Make judgment that will impact patient safety and quality care. So yung judgment mo from your, it should be clinical reasoning, no? Identify what is important on a daily basis for each client. You have to remember that our client is unique. They have individual needs, no? Magkaiba yung kanilang, you have to individualize your patient care. Carefully watch and listen to the patient to determine what additional questions to ask. Okay. Watch for subtle changes in the patient. Meron bang pagbabago? Kasi baka yung changes na to could be a sign of another problem or could be a sign of recovery. Diba? You can check or watch for it. Rely on assessment skills. Okay, so dapat you have your clinical eye. Use the 7 facets to assess the patient, not only the physical aspect again. Use information detected in assessment to work with the patient to enhance a quality of care. Learn to detect a change in patient to enable providing best care. And you have to take advantage of teaching opportunities that present with the patient and family. So every time that you are visiting your client, you have to take this as an opportunity to teach your client. Ano ba yung teaching mo? Like for example, ano ba ang dapat na kainin ni patient? What are the kung halimbawa hypertensive si patient, ano yung mga dapat iwasan ni client? Okay. Ano yung your health should be related to the current situation of your patient. Halimbawa, may wound si patient. So, habang nagbibigay ka ng wound care, you can teach your client how to do it. Kasi once the patient is discharged, mauwi na sila sa bahay, at least they know how to perform wound care. Okay? Continually reassesses the patient for change in order to achieve the best results. So that ends in our first and second chapter of this topic. Now for this week, there's still one topic. Okay, but let me end this presentation with this quote by Maya Angelou. As a nurse, we have the opportunity to heal the mind, the soul, the heart, and the body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. So, God bless to all. Okay, let's watch the other video for this week. Okay, this is the reference of my presentation. So, God bless everyone.